Hi everyone, welcome back to the SMA Victor, where we talk about all things related to spinal muscular atrophy and spread awareness about this condition. Today we're going to discuss the impact of SMA on muscle function. Let's dive right in. What is spinal muscular atrophy? SMA. Spinal muscular atrophy, or SMA, is a genetic disorder that affects the motor neurons in the spinal cord. These neurons are crucial for sending signals from the brain to the muscles, allowing us to move, breathe, and swallow. When these motor neurons are damaged or lost due to SMA, it directly impacts muscle function. How SMA affects muscle function? To understand how SMA affects muscle function, it's important to know that motor neurons play a key role in muscle activity. In individuals with SMA, these motor neurons are either lost or severely damaged due to the lack of a critical protein called SMN1, survival of motor neurons. Without sufficient SMN1 protein, motor neurons progressively degenerate, leading to muscle weakness and atrophy. This means the muscles gradually lose their ability to contact and perform daily activities. As the disease progresses, the loss of muscle strength can affect mobility, making it difficult or even impossible to walk, stand, or perform everyday tasks. But it's not just about the movement. Muscle weakness in SMA can also affect respiratory functions, making it harder to breathe, and can impair swallowing, increasing the risk of choking or aspiration. Different types of SMA and their impact on muscles. There are several types of SMA, each with varying degrees of impact on muscle function. Type 1 SMA, also known as Werning-Hoffmann disease, is the most severe form and often presents in infancy. Babies with type 1 SMA exhibit significant muscle weakness, leading to difficulties in swallowing, breathing, and achieving motor milestones like sitting up. Unfortunately, without treatment, many infants with type 1 SMA do not survive beyond early childhood. Type 2 SMA is typically diagnosed in early childhood. Children with this type can often sit independently, but cannot stand or walk without assistance. Muscle weakness in type 2 SMA is less severe than in type 1. But still significantly impacts daily life and mobility. Type 3 SMA, also known as the Kugelberg-Willander disease, often manifests in late childhood or adolescence. People with type 3 SMA can often walk, but may experience increased weakness over time, particularly in the legs and hips, which can lead to mobility challenges as they age. Type 4 SMA is the adult onset form and generally has a milder impact on muscle function. Symptoms typically appear in the second or third decade of life and include mild to moderate muscle weakness. People with type 4 SMA can often lead relatively normal lives with appropriate management. The role of physical therapy and exercise. Now you might be wondering, is there anything that can be done to help with this muscle weakness? The answer is yes. While SMA doesn't affect muscle function, physical therapy and exercise can play a vital role in managing the condition and improving quality of life. Tailored exercise programs can maintain muscle strength, flexibility, and overall function. Physical therapists work closely with individuals with SMA to design activities that are safe and effective. These exercises can include range of motion activities, aquatic therapy, and gentle strength training. Consistent physical activity can help improve the quality of life and help manage symptoms. Advances in treatment and their impact on muscles. In recent years, there have been significant advancements in SMA treatments that can positively impact muscle function. Medications like Spinraza, Zolgensma, and Evrysdi have shown promise in slowing disease progression and improving motor function. Spinraza was the first FDA-approved treatment for SMA and works by increasing the production of the SMN1 protein. It is administered via spinal injections and has been shown to improve motor functions in many patients. Zolgensma is a gene therapy that delivers a copy of the SMN1 gene to replace the faulty gene causing SMA. This one-time intravenous treatment has had remarkable results, particularly in young children. Evrysdi is an oral medication that also helps boost SMN1 protein levels and can be taken at home, making it a more accessible option for many families. Early diagnosis and intervention with these treatments can lead to better outcomes, helping individuals with SMA achieve milestones and maintain muscle function for longer periods. Thank you for joining us today to explore the impact of spinal muscular atrophy on muscle function. By understanding how SMA affects the body and the available treatments, we can better support those living with this condition. If you found this video helpful, please give it a thumbs up, share with your friends, and don't forget to subscribe for more content on SMA awareness. Be sure to check the links within the description too. See you in the next video.